Good evening, everyone. We're going to go ahead and get started. I see Al already beat me in the chat, but happy Pride Month. We're excited to get started tonight. Today's webinar is titled Getting to Zero, Engaging the Reentry Community, and brought to you by Proactive Community Services in collaboration with AIDS Foundation Chicago and Illinois Department of Health. Proactive Community Services, or PCS, was founded in February 2005 by an African-American woman who saw a need to close the widening social and health disparities that severely affected African-Americans. PCS is a minority-serving human service organization located in the South suburban community of Flossmoor and provides comprehensive services to 28 South and 5 Southwest suburban communities. The agency's service portfolio includes health and wellness and workforce development and supportive services. During this webinar, PCS invites faith leaders, community advocates, and other individuals interested in reducing the rate of HIV, STI, and other communicable diseases in Black and Brown communities to join this conversation facilitated by Al Forbes of Forbes Consulting, Pastor Charles Strait of Faith United Methodist, with our guest speaker, Russell Jackson. We encourage you to please join us next week for our webinar, Getting to Zero, Engaging the Houseball Community, Thursday, June 9th at 6 p.m. Central. You can also view recordings of past sessions on the PCS website at pcsil.org by navigating to past webinars in the Events and Webinars section of the homepage. Please continue this and other conversations on ending the epidemic on Facebook. As a reminder, your cameras and microphones are set to off, so please write your questions and comments in the chat box, which we will be monitoring. If you would like to come off mute at any point to ask a question for our speakers, please raise your hand and I will give you the floor. Also, PCS is looking to get more speakers for future webinars. Please send information for potential speakers to gtzwebinars@pcsil.org. And finally, as a disclaimer, the views and opinions expressed in our discussion are those of the presenters and do not necessarily reflect the official policy or position of Proactive Community Services. All right, with that said, we're ready to get started. Before we begin, let's allow everyone to introduce themselves. Al, will you go ahead and give us your background?
Hi, my name is Al Forbes. I am currently the sole proprietor of Forbes Consulting. And as a disclaimer, I am a consultant with both PCS and TRS. So I'm quite familiar with both organizations and excited to have a conversation tonight about one of the blind spots for many people, the reentry population. And as people know, we've been really working to have our blind spot conversations, and we will continue talking about where we may have blind spots when it comes to ending the HIV epidemic and getting to zero. And without further ado, I want to introduce someone who I've worked with for almost a decade, or a little bit over a decade now, Mr. Russell Jackson, Sr.
Thank you, Al. How you doing? Okay. So with Russell Jackson, I have care members. I have Mr. Oglesby. I have Miss James, Mr. McDaniel, and Mr. Carter. Hopefully also Reverend Doris Green would be on, and Kimberly Wallace, our COO. So what I like to do is kind of like tell you who we are, what we do, why we do it, and how it relates to the reentry population and getting to zero. So I'm going to share my screen here if I could. And can you see my screen?
Yes.
We've got it, thanks.
Okay, so TRS MWIPM, Transforming Reentry Services, formerly known as Men and Women in Prison Ministries. So what we're going to talk about tonight will be, I'm starting my slideshow here. There we go. So we're talking about reentry, the transition of reentry, and of course, no entry. And we'll get to that in a minute, exactly what it's talking about. So transition is the process, okay? Reentry, or successful reentry actually is the outcome. And of course, no entry is the goal. That's the goal we're trying to get to. Knowledge is power. What we like to do at Transform Reentry Service is to change the narrative by promoting awareness and education, providing support and access to treatment and care, and partnering with community-based organizations. I put this little flow in here, so it's like a little caveat for additional services and creative events that we've come up with in the past, like the stigma campaign, breast cancer awareness. We do voter registration drives, and of course, we have our People's Gala. So in the beginning, 1982, Women in Prison Ministry was founded as a volunteer organization by 3 women to provide spiritual and emotional support for men and women incarcerated in Illinois prisons. Move forward 10 years later, the organization was rededicated and incorporated as Men and Women in Prison Ministries to provide services to the incarcerated, formerly incarcerated, their families, and to the community at large. Progress. Over the past 12 years, as diseases has disproportionately affected minorities, communities, Transform Reentry Services, TRS, has expanded its service portfolio to address health issues such as breast cancer, sexual health, including HIV, hepatitis C, and sexually transmitted diseases. We have also introduced a new harm reduction program and a needle exchange program to address the opioid crisis on the south and west sides of the city. One of the first Black women-led organization to have an SSP and be part of DOP, which is the drug DOP, sorry, drug overdose prevention program. As progress going on, in 2009, the agency began health promotion and prevention programming targeting returning citizens for at-risk HIV. In 2015, the agency was awarded funds to educate African-American women about their risk for breast cancer. In 2016, the agency began health screenings for HIV and hepatitis C. And in 2019, they had a relaunch, a renaming. Men and Women Prison Ministry became Transforming Reentry Services. So I mentioned the CAB member. It's a consumer advisory board. Statistics says that 2/3 of individuals who are incarcerated, once they're released, will return to jail or prison within 3 to 5 years, like they get caught in a cycle of recidivism. Statistics says very little about that 1/3 who successfully make their transition and do not go back to prison and jail. So we call that the 1/3 making the difference. Changing a person's mindset, building a working relationship, all will create that change of the mindset. Transforming Reentry Services created this CAB through the Harm Reduction in Prison Coalition. The CAB consists of 20 to 25 men and women formerly incarcerated, like I said, with no criminal justice involvement in the 3 to 5 years. So our idea was to take a CAB member and a person would come in and that CAB member would be matched with a person to mentor him. He would mentor that person, a recently released individual. He would mentor them through their transition. Now, mentoring is one of those things where you have to really understand a person. Today, we have 4 CAB members on the panel. They will engage in the questions as soon as I finish with the PowerPoint. One recently released individual, his goal is to become a CAB member. He's also present with us today. The CAB members here represent 60 years of incarceration, meaning that all told, we were all incarcerated, including myself, a total of 60 years. The good thing about that is we also represent 51 years of post-incarceration, which means that we haven't had any type of criminal justice involvement in, let's say, 51 years. A caveat on the floor say invite a returning citizen to the table. I keep saying that throughout the presentation because I want people to understand that if you try to do something for me as a returning citizen and I'm not at the table, then you do me a great disjustice. I should at least be at the table to kind of add in some caveat, what it is that we need and want. And hopefully this presentation will, and the conversation will also allow people to understand what it is that we need when we get out, how we need to go about it. The Consumer Advisory Board is made up of ordained ministers, college students, business owners, directors, medical case managers, behavioral specialists, landlord, homeowners, social service workers, coordinators, medical professional, reentry specialists, paralegals, and supervisors. And again, I think if you have something and you're planning to do something, you should invite us to the table. Transforming people's lives. This is an act of returning to a place or to an organization or area of activity that you left. So you left a place and now you're returning to that. You need to try to fit in again, or perhaps go to a different place where you can actually start over. I think a lot of people like starting over as opposed to trying to go back to the old neighborhood and try to fit in. Reentry is an ever-changing society. Society has its own challenges and barriers. Some issues, society seems to think that public safety is the #1 issue. As you can see, they think it's public safety and employment, health, education, and then housing. Well, as you will find out tonight, the CAB members and the person who was recently released thinks that housing is the #1 issue. You help me find a great housing program. A whole lot of my clients who are HIV positive returning home from prison and jail wouldn't be sleeping under a bridge in abandoned houses and stuff. So just so you can see how society view things and how a person who's formerly incarcerated would view something, he figured housing and family would be more important than public safety and employment at that time. Reentry is not an understudied issue. It has seldom received significant attention from policymakers, though. So while the vast majority of reentry literature to date focuses on state or national level policies that create barriers to reentry, otherwise known as collateral consequences, there is very limited analysis of what reentry looks like on the community level. So again, this is from society viewpoint. Transition challenges and barriers. There's all kinds of risk factors that will sidetrack a successful transition. Mental health, family, behavioral health, emotional support, trauma, PTS. Anyone who's been incarcerated for any amount of time, wow, they experience some trauma. And a lot of times, if that trauma isn't dealt with, it can become a mental health issue. Transportation, sex offenders. We have a theme with sex offenders where they can't be housed. They just passed a new law where before the law said that only one sex offender can live in a residence at a time. Now they've changed that. So multiple sex offenders can live in one residence. And again, housing, recidivism, employment, food, age, and phone. I put phone on there because you'd be surprised how important phone is to a person coming home from prison to jail that need to be able to contact someone. Even like my clients, they need to get in touch with me. They need an Uber ride. They need to get to a doctor's appointment. The phone could be so important. Transforming people's lives. We got mental health on the floor, housing, lack of education, substance use. The no entry piece. It's just not, if you look at these prisons, they're just not a place for our children to be. At what age do we begin to talk to our children and kind of get them to understand, what's happening in our society? Mothers and fathers should not have to bury their children, you know. And to go into some statistics, the population in Illinois Department of Correction is declining. 2013, as you can see, they had almost 50,000 inmates in prison. In 2017, there was like 43,000. There was a drop of about 5,000. But if you can look, 2019, this was pre-pandemic, they had 39,000. 2 years later, post-pandemic, as of December of 2021, there was only 27,413 inmates in custody at IDOC, Illinois Department of Corrections. Now, whether that's because of all the good work that the agencies are doing on the outside, or whether that's because people aren't going back and forth to prison like they used to, or it could just be due to the pandemic and all the early releases. All that will be discussed momentarily. Okay, so what worked in transition and reentry? What do we need to do? We have to change a person's mindset. There's treatment, the mindset, there's family support, there's therapy. What we really focus on is getting the person to the point where they can move forward. Social Security card, birth certificate, official state identification card will allow a person to access services that are available to them. The identification restoration is a reentry project that we have and then we also have the responsibility to discharge package. It's a package with the wealth of information in it. We send it into the prison. It's on IDOC website. It's on our website. People are always requesting this before they have an event so they can have it patched out. What's inside that directory is about 300 agencies that does reentry work and does HIV work for the state in the state of Illinois. So what we want people to understand is that, help is available, and we will often ask them, do you have a plan? The resources are here. And then we have to ask people, can we assist you? I'm saying, because everybody don't want help, but for those who want help and seek help, then it is available to them. Another thing about being at the table, this is lived experience at the table. I can't stress enough how important it is to have returning citizens at the table when you are deciding to do an event, to write a grant, to establish a program. It's invaluable. Again, like I said, if you come together to do a reentry program, I see these people, I see it all the time, they're doing reentry programs, and here we are sitting here waiting to be invited to the table. So what they actually do is they do a great disservice to the reentry population. They do a great disservice to the HIV population because they're not at the table when these things are being done. Reverend Green went to California and she came back and started a harm reduction in prison coalition. So a lot of our programs came from there. Our idea was to get condoms in prison. Right. So it didn't happen, but we tried. And what we did end up doing is we got better health care in the prison. We found out through the coalition that, there wasn't adequate health care in the prison system. People were coming home telling us about it. And what we did was we was able to get the Wexford Pharmaceutical, we was able to get them audited. They're trying to get them out of Illinois, but it takes time when you're dealing with a $1.4 billion contract and providing healthcare services in the prison. But those are the things that we try to do. As you see, this is one of our board meetings. One of our staff meetings where we discussing the proper handling of people. You just can't talk to people any kind of way and treat them any kind of way, and then expect for them to come to your service or return for different services. In this particular table, as you can see, there's 94 years of lived experience at the table. So in collaboration, these people have spent 94 years in prison. the one thing I want people to understand is that, you know, we're not new at this. We've been doing this for a while. You know, we've been going to the prisons, to the Summit of Hopes, to the county jails. We've been doing this for a while. We have two Ryan White case managers, A and B, and you know, they have a caseload of over 30 people who are HIV positive, and we're helping them manage their cases, their lives, basically. I talked about the needle exchange program. Remember of DOC, and we do campaign where stigma stops right here. So what we found out was that people was coming home from prison and jail and going to the halfway houses, okay? The recovery homes, or sometimes to their own home. And what we found out is that they was using drugs before they went in. When they came out, they wanted to use drugs again. They would go and get a lick and they would overdose because they tried to take the same amount of drugs that they were using before they went in when they came home. So we decided to, Reverend Green and Kim decided to get into this harm reduction field because our people are dying. I mean, they're coming home and they're dying without having a chance. They're putting fentanyl in the heroin, and now they're putting a animal sedative into the fentanyl. So the returning citizens are dying. So we figured it was a great thing to educate people, pass out literature, the Narcan, the naloxone, clean smoking kits, clean snorting kit, clean needles, additional educational material so they can educate themselves on what's going on now as opposed to 10, 20, 15, 20 years when they went in and now they're coming out to a whole new society. Again, we want to change the narrative. We do HIV screenings, we do routine vitals, harm reduction and prison coalition. We have clothes. We mail out over 100 letters a month. Inmate correspondent, Brother Muhammad does that. We have this consumer advisory board, and of course, we do the capacity building where we will educate smaller organizations, although we're smaller, and we'll educate smaller organizations about funding opportunities, about grants, and just funding opportunities so they can get in line and know when these grants are being released and when the money is coming out. So if they in the field of HIV or reentry, they can be able to fund their organizations. Facilitated referrals. This is what we do with the facilitated referrals. So if someone needs housing, we don't necessarily do housing, but we're able to put people on the housing list. We're able to send people to food pantry with a name and an address and a phone number, as opposed to just sending, go over here or go over there. No, we're able to give them a name and a phone number, go to a place and ask for this particular person. And most of the time, that person is expecting them to come. Substance abuse, behavior, and mental health. Today, we're celebrating 39 years as a community-based agency implementing sustainable service for the reentry population. Of course, it takes a village to raise a child, and it takes a team to impact change. Again, these are the CAB members. These are their email addresses. I want to make sure we got the email addresses up here. I think I left off Mr. McDaniel, but it's Jephatha, JEPHThat.McDaniels@transformerreentry.org. You can reach these guys if you have any questions so returning citizens. If you're not at the table, again, I keep talking about this being at the table when decisions are being made. If you're not at the table, then you're probably on the menu. I got a bunch of question marks here for anybody that might have questions about that. And lastly, giving honor to whom honor is due. Minister Michael D. Smith, Reverend Doris Queen Makita Green. They are our founders. They allow us to do what we do. Again, on that one picture, I want you to remind 94 years of incarceration. That's a lot of wisdom. That's a lot of knowledge. We have over almost 100 years of post-incarceration for the whole CAP. And what we do is we just want to give back. Just like Minister Michael wanted to do. He wanted to give back. He wanted to have an organization that's available for people coming out of prison and jail that would actually help. So with that, I want to say thank you so much and my cab members. Any questions you may have, they will answer any questions. I can't see who's there, so I'm just stop sharing my screen and we can go into the conversation. Thank you so much.
Thank you, Russell. Very much appreciate it. So before we get going, I see that Reverend Strait has joined us. So I'm going to ask Reverend Strait to introduce himself, and then we'll ask the cab members to give us a brief introduction so we'll know who we're talking to for the next hour. Reverend Strait?
Thank you, Al. I'm so sorry I had technical difficulties getting on the line and some issues here at home, but I'm glad to be here and especially to hear from this group. I worked with Reverend Green for many, many years, and it is a joy to see the fruit of her labor. And I want you to know that we're always looking for opportunity to serve and to work with the reentry population. It is great to hear this presentation and to see the magnificent work that you're doing. And thank you so very much for
Thank you.
So let's go to the cab members that are going to be the primary speakers. Ms. James?
Is she there? I don't see her.
Okay.
I think I see her on there. Yep. I'm allowing them to talk now.
Okay.
Oh, okay.
Ms.
See
James?
if she's able to do it now.
Good evening. Can you hear me now?
Yes.
Yes. Welcome.
Good evening. My name is Sataria James. I am the HIV/AIDS Community Healthcare Navigator for Transformer Reentry Services.
Mr. O?
Can you hear me?
Yes.
My name is Marlon Oglesby. I am a Ryan White Medical Case Manager for Transforming Services. I'm also the chairman of the Harm Reduction in Prison Coalition, which Mr. Jackson mentioned in his presentation. Thank you.
Mr. McDaniels?
Mr. McDaniel, Harm Reduction Manager for TRS.
And the Minister Lionel Muhammad.
Carter.
Carter.
Oh, Mr. Carter's with us. Mr. Carter, I'm sorry.
You're muted.
Good evening, everyone. Y'all hear me?
Yes.
Yes.
Yeah, this is Vincent Carter. I'm the outreach coordinator with Transforming Reentry Services.
Thank you. I think we're going to have a real good conversation. We have a little bit, about an hour left for us to talk, so I think we have enough time to get this discussion going. I do want to say that 2 weeks ago, we did have someone speaking to us about housing, and housing is an issue I think that the state of Illinois is going to have to address it, as it does directly impact the HIV communities, LGBT communities, the injection communities, the returning communities. So all the communities who are at greater risk and vulnerability, the communities who housing exacerbates, the lack of housing exacerbates their risk of HIV. And of course, that includes our sex working community. So if you're involved with transactional sex, that your housing situation is often one of the reasons why you're engaged in transactional sex. So we want to really have an adult conversation where we can take our blinders off, look at our blind spots, and realize while we may be doing this work, where are we missing the messaging? Who are we forgetting about? Who's not being let into the conversation? As Mr. Jackson says several times, who's not at the table? Because if our true point is getting to zero, it's going to involve all of us getting to zero, for Illinois to get to zero, and for the country to get to zero. So in a real conversation, we cannot neglect or be remiss about talking about those vulnerable populations due to economics, social economics. So one of the questions I have for the CAB and for Mr. Jackson is, as we look at the work that TRS is doing, which is has grown tremendously over the past decade and a half. How do you see the CAB and those returning individuals engaged with HIV and engaged with getting to zero? How has HIV impacted the population? And I'll leave that to anyone on the CAB to answer.
Okay, I guess I'll say something. The impact of HIV. Not only am I a medical case manager, but I'm also a HIV hepatitis C test counselor, which I test for 8 people for HIV. One of the biggest problems with getting to zero that I've said for a long time, I'm encouraged by the fact that they want to get to zero, but I'm also hurt by the fact that education in Black and brown communities is so narrow. I can count on my hands how many times someone has said to me, I understand what the word PEP means. Or they know about PrEP because they see it on TV, but I haven't found not one person that knew what PEP was, which is post-exposure prophylactics. And if you don't know what that is, I'm gonna give you a quick education. Post-exposure prophylaxis is something that you take if you engage in sex with somebody and within 72 hours of engaging in sex, if that person was HIV positive, you have 72 hours to get this drug from your doctor, and you take it for a 28-day regimen. And at the end of 28 days, you are now free from catching HIV. You will not catch HIV. Now, what's so important is because we have such a free society right now, and the use of condoms has been diminished greatly. Safer sex is not the top priority when it comes to our young people. So therefore, if you want to end or get to zero in any kind of way, we have to educate people not only on PrEP, but also on PEP to help curb the I'm done for. You know, I got it. It's over with. When there's an opportunity, there's a small window to protect them, even when they don't want to protect themselves by just using a condom. So, you know, education is a very serious key that is not taken care of in our Black and brown communities because they don't know about these things. Thank you.
And are we finding that true for men and women equally?
If I tested 100 people, I would say 95 of them don't know about PEP. I'd say 70% of them know about PrEP because of the commercials and stuff. They might not know exactly what PrEP is. They've heard of it though. But when it comes to PEP, PEP, none of them have heard of it. Every one of them been astonished when I've told them that.
Yeah, and in my excuse me, in corrections, so I'm Ryan White Part B. Mr. Oglesby is Ryan White Part A. All of my clients have criminal justice involvement. Most of his clients do not have criminal justice involvement. So what I hear is that, oh, that's the AIDS pill. So they call it the AIDS pill. So if I take this, I'm not going to get AIDS. So a lot of times for my clients, and first my clients was basically older people in their 40s and 50s. Now what I'm seeing is younger people coming in, you know, that they're in their 20s and 30s and they're fearless. You know, this perception or this concept is that I don't have to worry about it. All I do is just take a pill. That's just what I'm getting. They can just take the pill and not have to worry about being safe or being cautious or whatever. They can just go out and I think that was a lot of the pharmaceutical had problems with PEP and PrEP when they first came out because they figured a person would just go out on the weekend and have a good time and take the pill, as opposed to, you know, taking the pill, well, I think 4 or 5 times a week. They just take it on the weekend and go out and have fun, and then it wasn't working like that because you have to have it in your system so many days out of the week or out of the month in order for it to actually work. Okay, I just wanted to add that.
That's important because I think that there's a lot of misunderstanding about PrEP and PEP. And I think that that's one point that sounds like where you're saying that in terms of engaging the returning community, we need to do a better job of in the education component, because we don't know for sure what education they may have gotten while they were incarcerated about HIV or how to avoid HIV. They may not even know that HIV can be, that U equals U. They may not know about that. So it sounds like for individuals who are engaging with the returning communities, it's really important to make sure they understand what's going on since they've returned home or since they were incarcerated. And I think that's an important point that we need to make sure that our literature in the waiting rooms as we engage are up to date and provide that level of knowledge. Pastor Straight, I think you had some questions you want to ask.
Well, I wanted to kind of, yeah, I did post them in the chat, but I wanted to kind of jump in here and say, to me, this really highlights the issue of safer sex that I agree with you has gotten about it in spaces where we need in families, where we help people to understand that avoiding getting HIV in the first place is much, much better.
Pastor Straight, I think you're having some technological problems. We're having trouble hearing you. It might be better to try to leave those questions in the chat, Pastor Straight. Then I can read them off if you'd like.
Yeah, and I think that what Pastor Straight might have been alluding to is that ounce of prevention is much better than all the medication and treatment modalities that come if we don't prevent HIV. So really focusing on that prevention. I think you're there, Pastor Straight.
Hello?
Go ahead. Go ahead, Pastor Straight.
Yeah. So part of, yes, that's exactly what I'm saying. Really what I'm saying as well, that taking medications that have long-term effects on your body that could cause other kinds of problems like kidney problems, liver problems, is not the answer to wanting to have sex. Simply wearing a condom prevent you from getting HIV infection. And to not educate young people and old people alike for that matter, that there are consequences to the quick
Technology sometimes is not our friend. But again, I'll jump in while we wait for Pastor Straight to come back in. I think that again, we want to make sure that our returning citizens know the value of using condoms, the value of using PrEP, and so that people can make the best choices based on their decision.
Should be something that we emphasize at helping people understand the best solution.
Not sure what's going on with Reverend Straight's tech tonight.
He going in and out a lot.
Yeah, I think he's just breaking up. Like I said, it might be better, Pastor Straight, if you just write your questions in the chat and I can read them off. But I'll throw it back to Al to continue on what you were trying to express there.
Yes, I think it's really important that we have given people options and choices. We can't dictate to people how to live their lives, especially those who are returning citizens, because they've been under someone's thumb for a number of months and years in some cases. So I do want to hear from the CAB in terms of what have you found that works in terms of HIV prevention for returning citizens. And I want to preface this with something that one of my trans sisters says, and she was on with us last week, that sometimes the best HIV prevention has nothing to do with HIV. So I want to open that up to the CAB to talk about what has worked in terms of opening up conversations with people about HIV or getting people to test for HIV, STIs, or hepatitis C. What is working at TRS?
This is Mr. McDaniel, Harm Reduction Manager. One thing we are recognizing out in the field, when we're testing people, is just having that overall knowledge, giving them that knowledge and removing the stigma and understanding of how you can actually catch HIV. Some of our clients that's coming home from prison, they still under the notion that you can catch HIV from kissing or using a spoon.
What?
Yes, from kissing.
What?
Or I know, but this shows you the lack of information that they have in prison, that they're coming home after 15 years and they still have this mindset and they still believe that they can catch HIV from eating off a spoon from someone that has HIV or kissing someone that has that. So that just shows that the lack of information that's in prison that they're not really getting. So what we have is like our resource center to where, you know, we first of all, we make the brothers feel comfortable to talk about it, because one thing we have found that it's hard to get people to talk about their sexual experience in period, let alone in prison. So to get them to be comfortable with us to talk about that and open up to have that dialogue with them so we can have that honest conversation to where we can help them with what they need. And it's just amazing that the brothers just don't have a lack of knowledge. You know, it's like my boss will always say, my people perish by the lack of knowledge. It's just the knowledge that is not out there and the resources, letting them know what organizations they can connect to as well. Because sometimes we can have the knowledge out there, but our people don't know where to access these resources. So therefore, it's like they don't even have the knowledge to begin with. So that's one thing that we have learned in our field with just testing people, is just having that knowledge, busting that stem and bust of that, how you can catch it, how you can contract it, and explaining to them what is, you know what I mean? Understanding that if you have contracted this disease, it's not the end of the world. You know what I mean? It's not like it was 25 years ago, 30 years ago. Bringing their mindset up to date. Oh, my uncle died from this. You know, that was 1983. We living in 2022, brother. We have so many different medications, and one pill a day can save your life. So just educating them on that piece and helping them be more comfortable to be tested and to share that what I call that raw information to where we can better and engage with other individuals that's coming home from service. So that's what I've learned that works for us in our field. Thank you.
Thank you. What do you see the role and impact of stigma, shame, guilt, and fear are with this population? How does that create a barrier to access services?
So in our community, you would be surprised how many people are they're scared to come up to get a condom, let alone a card from us. They would think that it's Ebola. So to break that stigma, for them to let them know, first of all, it's nothing wrong with this. This is normal, because you will go right to the station and pay $1 to get a condom when you can just come to us and get this free education. So it's getting them to be comfortable to come to us and not having that, oh, people watching me or they gonna see me. You know, it's still crazy that we live in the world we live in and people are still concerned about other people's business. When we be on site, we'll have people that will walk past our table 2 or 3 times before they say, oh, let me get a pipe. They didn't want so-and-so to see them, or they didn't want this person to see them. And we respect that, you know, I respect it. So we get it, but sometimes it's just, it's that stigma to where people are ashamed of what they're doing and who they are, that it keeps them from coming to access the service and the resources that we have to provide for them.
Thank you. And Mr. Carter, I want you to jump in here because I want the audience to know where you operating, because I heard Mr. McDaniel speak several times about the table and being out there. I want to make sure people know how out there TRS is. So where are you actually located for the work you do?
Mr. Carter, can you hear?
So we have several sites. On Tuesday, we're on 35th and King Drive. Wednesday, we're on 63rd and Vernon. Thursday, we work out of our office across the street on Harrison in California, and as well as Madison and Holman. We split the sites up, predominantly because one of our sites is more so for needles. We like to give up a lot of syringes towards California. So we have several sites out there. We also partner with different organizations. We just had an event, as you mentioned, Al, we just had an event that was a huge success.
Hello?
That the people came out into the neighborhood and they really, they really welcome us into the neighborhood, even to where today, where when we walk into the office, they wave, oh, how you guys doing? How you guys doing? When y'all gonna put on another event, or when y'all gonna feed us? So that's always a good thing to get that positive and that welcome in the community. So when we setting up our site over there, they know now this is TRS. First, they thought we were the IRS. So they were like, oh, I don't want nothing to do with y'all. But now that they know we are TRS and what we stand for, or when they see the red truck or when they see TRS, they know exactly what the organization stands for, what we can do for them. And they spread the word. They spread the word. One thing we have learned is, Brother Al, is in the field, word of mouth is your friend. You know what I mean? It's your friend. Like, we don't even have to go and look for participants now. Now that we have did that event and people actually know what we're doing, they tell everybody, oh, I told them y'all gonna be over here, or they come knock on the door, and I welcome that, you know what I mean? Because that's an individual who didn't have clean syringes or a clean utensil, that's coming to get something clean to prevent them from passing something on or harming themselves. And then
Hello?
that time to be able to talk to them.
We hear you, Vincent.
Y'all heard me?
Yeah, we hear you now.
Oh, sorry, I didn't mean to cut in like that. I've been trying to work on my sound.
Okay.
No, that's not.
But y'all want me to jump in where Al was asking about the sites and stuff? I'm sorry, I didn't mean to cut
Yeah,
off.
absolutely. Go ahead.
But yeah, I was saying that yeah, we do 4 major sites. We set up a new site right outside our office right here at 609 South California. It's right on the corner of California Harrison, and it's really like a hot spot already. I mean, like immediately it was a hot spot. So we get a lot of engagement like right outside of our office, which is great. So we're going to start getting people. We do 35th and Prairie, which is like down the street from our South Side office. We do 63rd and Drexel, which is right there off 63rd and Cottage, like a block off Cottage, and that's another hot spot. And then on Thursdays we have a guy that Rock hooked up with that does a larger needle exchange. We try to catch him on Thursdays, but we also come right back outside our office and do site here on Thursdays. So we busy as far as the field and engaging. What I found to be the simplest way to get people very comfortable with everything that they're viewing is to not even talk about that. I go straight up to them with one of our ID cards and I begin to explain to them what our primary function is, which is the ID, birth certificate, and social. And that kind of lets the guard down into them starting to ask questions about what we got on the truck. So that, that's just one way of allowing them to kind of feel like they control in the conversation some, and you're not shoving things at them. They're kind of inquisitive about what we're doing. But Rock is right. There's a big stigma that we have to kind of break through, because I have to literally run toward people with the card to tell them, hey, we out here trying to get people their ID, birth certificate, socials. We're not just here to pass out crack pipes or you're Biden. Everybody has an opinion about what or why we're doing what we do. So I love when Mr. Jackson explains why we do what we do.
So for the listening audience that might not be familiar with what you distribute, can you walk them through all these things that you have available when you do outreach?
Yes, we do harm reduction along with the COVID information packages. So harm reduction includes anything that a person uses, drugs, illegal or legal, to do it safely. And we try to supply them with what those things are. We have smoking kits. So for smokers that smoke their drugs, we provide them with the utensils to smoke those drugs with, the tubes, the screening, the pushers, whatever. We give them mouthpieces. We give them petroleum jelly for their lips. You know, we give them alcohol pads. Tutors, the same thing. We give them a little water and their razor blade or whatever they need in their little kits. And the purpose is to have users not sharing things. So, you know, especially the shooters, you know, we give them everything that they need for a clean shot. So all the little cookers, pellets, water, whatever they need to prepare that shot and do that shot cleanly and safely without the sharing. We try to provide those things. So we're in the field, we're passing those things out. And I think that draws the stigma, you know, of you know, where people want to have an opinion about why we're doing what we're doing. So, you know, it's easily explained, but when you got 15 to 30 people walking past and one person says it, you know how a crowd is now. More of them starting to get that opinion. Oh yeah, they out here doing that. But I love how Rock engages with them. I'm loving how I'm learning to engage with them when it comes to that, you know, without becoming offended or being offensive. So, you know, it's just a matter of humanizing and empathy.
Yeah, with the goal of being clean use and not sharing equipment and keeping people alive. And I know that Kim Wallace is really adamant about that, that if we can keep you alive today, we can come back and talk to you about HIV, HCV, STIs tomorrow. But if you overdose today, we can't do anything for you tomorrow. I do want to turn to Miss James for 1 minute, because you also distribute Narcan and naloxone. And I know that Miss James has a story about some of the work she's done around that from a personal and professional perspective. Miss James?
I'm here. Now, what did you say you wanted to hear?
About naloxone and Narcan. I believe you have a compelling story about why that's important to distribute to people based on your personal experiences.
Yes, I think Narcan and naloxone is very important as far as saving lives. Even if we do give it to people to partner up with people to save their lives. I had an incident where I seen a young lady at a bus stop, thanks to a training that my CEO and COO put us involved with. I was able to save that young lady life with the training that we had. Uh, it was a scary situation because I'm afraid of needles, but I was always told by our instructor that when the moment came, that fear of needles would be out the door. And that happened just the way he said it would happen. And I was able to save that young lady's life. My second incident was a guy that I was dating. His brother was an addict and somebody gave him bad drugs one night. And I was on my way leaving their house after engaging with the mom. And her son was having an overdose. I was able to get out to my car because I keep them in my car. And I was able to save that person's life as well. So the trainings that we go through is very important. And I thank God for those trainings. I thank my COO and my CEO for putting us in those trainings, because without those trainings, I wouldn't have been able to save neither one of them people.
Thank you. And I believe you said the police and the EMTs verified that had you not been able to just administer the Narcan, they would not be with us today. So that's two people who are still on the planet because
Yes.
of simply carrying Narcan and naloxone.
Yes.
And how long is, Mr. Jackson, I think you do the training for the community. How long is that training?
It varies. Actually, Mr. McDaniel and Mr. Carter does those trainings now. I used to do them a long time ago, but they have modified the trainings. I think they have like a training, 3-hour training. Back then, you want to jump in there, or Carter, you want to jump in there, and they have different levels of training right now. I have a 9-minute video that I use to take out with me with a computer, and 9 minutes is enough time to educate a person on how to use naloxone, how to identify a person who's overdosing, and so forth. But a lot of times, the additional training is better. So, McDaniel?
So we also, with that training we also do a demonstration as well, where we have the participants to feel comfortable with getting familiar with the needle and be able to extract the Narcan and we have a fake metal suit that we use, and we let them shoot it in my arm to get familiar with them. Because the first thing we tell a person in a situation like this is to gather yourself, you know what I mean? To gather yourself, to breathe, and then to proceed. Because sometimes, as my coworker said, sometimes that adrenaline, that can be so much, and you want to be able to act instantly, that you forget all of a sudden that you scared of needles, you know, and that will actually just wipe out. So we have a 30-minute training, a 15 minutes presentation we do on a PowerPoint, and then we do a 15-minute a demonstration where we let the participants to come up to get familiar with the Narcan, drawing it in the needle and sticking it to the arm. And we also do questions and answers. So it varies on the group size as well. So sometimes the group size can be 20 people. We might have 20 people. So we might be there anywhere between 30 to 45 minutes to an hour. It depends on, you know, the group size and the participation as well, sir.
And is that available to CBOs throughout Illinois and to individuals? How can people access the training?
They can access the training. They can go on our website and request it, or they can reach out to me personally. My name and information is in the chat, or they can reach out to the organization and request the training. And we pretty much go anywhere. You know what I mean? For the right cause, we even travel for out of state. So we pretty much go anywhere that we can pump the message of overdose and saving the lives. We all there. So just reach out to Mr. Jackson, myself, Mr. McDaniel, or Mr. Carter, and we can take it from there.
Excellent. And I do want to put a disclaimer out, because I don't want people who are listening who might not be familiar with the returning citizens. We're not trying to intimate that all returning citizens are on drugs or using drugs or have drug issues. What we are talking about is that we know that within Black and Brown communities, where there are reentry individuals, that there are also drug users, and sometimes those two do intersect. But we're not intimating that everyone who comes out of jail is addicted to drugs or using drugs. That is not our claim here at all. But I think it's important for us to look at what's going on in the community if we're trying to reach people in the community to solve HIV, STIs, hepatitis C, or any other of the factors that cause our community to be disproportionately affected in terms of health. So I just want to make that clear, so no one says, well, you know, all the people coming out of prison are drug addicts or using drugs. That's not the case.
Am I able to be heard at this point?
There you go. Go ahead, Reverend Strait.
Yay. All right. So one of the questions that I had is, I hear all of this work that you guys are doing, the tremendous work, by the way, that you're doing with the reentry population. Do you have a similar harm reduction program for persons who are in the community, families, churches, civic leaders? Because I think that stigma goes both ways, right? That we do harm to returning citizens in our bigotry, in our misinformation, in the ways that we treat folk. Now, sometimes it's because we've had bad incidents, right? If you've got a cousin, a son, a sister, someone who has been addicted or has had problems in the past and they've caused you problems, of course, you might have a negative outlook. However, many people have stigma that is not associated with trauma that they've experienced from, you know, persons who've gone to prison. And how do we overcome that kind of stigma within our community, within our churches, in places to help people understand that returning citizens, first of all, have this huge cloud over their heads. And not only just a cloud, but they also have all of these barriers that keep them from getting back into the community and working hard again.
Straight up, I would like to try to answer part of that. My name is Marlon Oglesby. One of the things that we must do as returning citizens is lead by example. At one point prior to the pandemic, I used to go to these classes that I can't think of the name all of a sudden, where we go to the task meetings, where they actually brought returning citizens to there. They didn't have an option, they had to go. But I would come in and I would tell them, hey, the only difference between me and you is I wear a suit. I did 17 calendars. There's nothing you can tell me about prison that I don't already know. But what I can tell you is I've been home. Now I've been home, this is 2022. I've been home 13 years. And the reason I've been home 13 years is because I had changed my mindset. I decided to do something different. I decided to say, hey, I want to do something to better myself. And now I'm doing something to help people. The key to erasing stigma is replacing it with fact. The fact is there are people out here that are formerly incarcerated and they're doing well. They're not only doing well, they're leading the charge in helping people. You know, they make a difference. When you've been affected by prison, what happens is when you decide to do the right thing, you end up helping people. It's just an unconscionable thing that it happens. There are a lot of people that don't do anything. They keep their head down low and they move on. But there are a few people that make it the point to lift their other people up. See, it's a systemic problem where we are easily to bash someone who's formerly incarcerated and then look for them to get in trouble and then almost push them into trouble because we don't give them jobs, we don't give them housing, we don't give them an opportunity to make a difference. But we have to allow people to grow and have to give them an opportunity that they can change. The reality is that the only difference between someone who's incarcerated,
Keyword opportunity to live, opportunity to work, opportunity to re-enter the community. And
yes.
I think that that's something that we need to be looking at. And as I said earlier, sometimes the best HIV.
We lost you, Al. Al?
I jump in there, Mr. J. This is Mr. Carter.
Oh, okay, go ahead.
Yeah, I would just add that to respond to what he was saying about reaching out to the community and the churches and things of that nature. We actually do that currently. You know, I have several churches that we deliver boxes to that have shown an interest in some of our materials. All of them aren't very interested in the harm reduction materials, but they're open for the conversation. What I've come to realize, and I think we all know this, you know, a lot of the people that aren't using drugs, it's their family members that are using drugs. So pretty much we all know because we see it even if we're not experiencing it firsthand. So just like incarceration, you know, an individual gets incarcerated, but the individuals that are close to him are going through that experience as well. It's the same thing with drug use. So we have to kind of treat those people ginger too with this subject. So we is once again, it's humanizing and empathy. And if the churches and organizations that haven't shown an interest yet or have a heavy stigma against it, I think they will begin to humanize and empathize with the person or the people that they begin to come in contact with or correspond with, because we all are coming very close to corresponding with people that have these issues because it's almost impossible not. So yeah, we as an organization, we are already reaching out. We're already opening doors, windows, anyone who wants to be a part of what we're doing. We're very inviting, we're very encouraging as an organization. That's one of the things I love about this organization. And we're constantly establishing relationships. You know, Rock just established a couple of relationships last week. I established a relationship last week that we're both waiting to pan out so that we can report what's going to happen with that. But the opportunities are always there.
Right.
I saw a very interesting. I saw a very interesting comment in the chat just a minute ago about grace. And so often in the faith community, we have to be reminded of what grace actually means. Reverend Green and I worked together a while back, quite a while back, in fact. And part of the problem that we had was helping faith communities understand harm reduction. The idea that it is our mission, it is our job to keep people safe until they can come to a place where they can move from wherever that place of harm is. You cannot help a person. You can't save a person's soul. You can't do whatever it is that your faith teaches you that you're supposed to do with people if they're dead. And so the idea that we as a faith community really must embrace this idea of meeting people where they are, loving them where they are, helping them right where they are, with the intent that we can make their lives better and thus make our lives better. When we help persons not become HIV infected, not have overdoses, and the list just goes on and on, have a place to live and not have to live on the street. We also make our community safer. We make less disease in our community. And thus, we're not just helping the folk who we look at as doing harm, we're also helping the larger community. So this idea of harm reduction has to be taught, in my opinion, in a very moral way that helps those of us who consider ourselves to be people of faith and moral people see that the person that we follow did not start by asking people what their problem was. He started, and I'm talking about Jesus for those of you who may not have been following that analogy, he started by extending help, extending healing, extending a way for a person to find the love of God in the experience that they had with Jesus and his disciples. So I want to do whatever I can to help in that regard, helping with religious people understanding this concept of grace and a harm reduction from our perspective, I think is a huge part of getting to zero and also helping the returning citizens in our community find a better way of life.
Exactly. And I think that we've talked about this in the past few weeks. Lead with love, not judgment. And if we truly lead with love and not judgment, then we're not looking at identifying, are you LGBTQ? Are you a person who uses drugs? Are you a sex worker? Are you someone who has mental health issues? Are you someone who has substance abuse issues? We don't look at that. We lead with love. We engage another human being in the process of walking this journey we call life. And I do want to flip back over to TRS because I know you have some of your leaderships also on the line if they want to jump in. I've seen Ms. Wallace has been texting and typing into the chat room, which I appreciate. But if you want to speak out some of your truth, Ms. Wallace, feel free to raise your hand and Andrew will unmute you. We'd love to hear you join. If the Queen is available, she wants to join in, please do so. But I do want to go back to our guest speakers. We have about 20 minutes and allow you an opportunity to speak as well.
Hello, can you hear me?
Go ahead.
Oh, hey everybody. I didn't know I was in the question part and I was just typing up. But Reverend Strait, I had mentioned, I'm Reverend Green's daughter. I don't know if you know that, Reverend Strait. And I'm really impressed with what you said, brother, because that, when I kept putting in the chat, grace, leading with grace, leaving the stigmas and all of those different things at the door and really meeting people where they at, you know what I'm saying? And giving them access to these things that a lot of other populations have been gaining all the while. You understand what I'm saying? Now, in our communities, we can be able to provide these services for people so we can save their lives, and I'm so proud of this, about the staff. Y'all have been doing so great on this call. You know me, I get so charged up and emotional because I'm so proud of y'all. Y'all lead by example. You know what I'm saying? You are people with lived experience. And I'm just so grateful to be on this call right now and see the work that we are doing. And Reverend Green, she sends her love, and that's it. I just had to get in there. Thank you.
Thank you, Kim. Al, may I say something? I put my hand down.
Of course.
Okay, so I just want to say to have this harm reduction program, a lot of things go into play. We have to build relationships. We're trying to build a relationship with the community. We have to build a relationship with the police department. We have to build a relationship with the alderman of the ward. We can't just go into places and start doing what we feel is that we want to do. So we have to let people know that we are where we are and what it is that we're doing. I was reading it in the chat earlier about a lot of times, I think when we first started this, we was working with the West Side OBR Task Force. Now, some people, I had to question the staff for a moment because they wanted to apologize for passing out clean supplies. And I told them we're not going to be apologetic about this just because someone don't understand what harm reduction really is. I said, we're going to go and do what we're going to do. We're not going to be bashful or we're not going to be arrogant about it. But we feel, if we really feel that, this harm reduction is necessary and needed in our community to help save a life, then we need to continue to do that. So we continue to build our relationship. I think there were so many police. What they didn't mention was that on the corner of California and Harrison, on the 14th of May, the cab members went out and cleaned that corner up. We had about 29 bags of garbage when we got done. And then the following week, we went out and had a cookout, building relationship in the community. I think I saw more police there at that time than I ever seen before. They just came out to support us, to let us know that, that they know that we're there and they know what we're doing. So, and then I saw another question in the chat, a comment in the chat about people who are so-called educators, supposed to be educating, but they lack the knowledge to be able to educate people. That's where the cab come in. I remember talking about I didn't understand how alcoholic could help an alcoholic until I came out of prison and I realized that you needed a person who had been to prison to be able to help a person that had been to prison. I mean, you understand what I'm saying? So I understand the trauma. I understand what a person goes to. So a person can come in this office and they can just go off. And I would just sit there and wait until they finish and let them go off because I know wherever he's been before he got here, he didn't get what he wanted and he just needs to let off some steam. And that's just understanding your population. So I think it's important. I give kudos to Kim and to Reverend Green. First of all, for giving me a job, but at the same time, having that compassion to know that, that we wasn't all that we went to the joint, but we wasn't damaged, that we still had the passion and the desire to come out and to serve. So the cab members, they serve, they don't get paid, they go do this, they do that, they clean up, whatever we need them to do, they come together and do it. And as you looked on the presentation, they're successful, they're business owners, they're homeowners, you know what I'm saying? They have good jobs. And now they want to take a moment to give back, to give back to those returning citizens who ain't quite got it yet. But we're going to keep working with them because we know they're going to get it. And then I'm going to just move over to Kim. I see your hand up.
Okay, y'all. Oh, if I didn't say who I was, did I say who I was? I'm the COO at Transformation Services. But I'm just so excited. But I wanted to say, because we're doing so much great work. God is so good. I wanted to mention, I don't know if McDaniel had shared this, but for me, something powerful happened last week, I believe, where some of the police officers on the west side of Chicago, they had actually attended our community event that we had, introducing us to the we opened up a new west side location and they came out. But addition to that, they came to the office after the event a few days later. McDaniel, if you wanted to add, and they came to get Narcan. And they also took McDaniel, one of our outreach managers, and took them into the community and showed them areas in which they wanted to help. And for me, when you think about our community and its relationship to, Black, the the overly policing and criminalization of Black and brown people, right? And the relationships that we have with the police and how they view us, right? You know, just not even about being a person that uses drugs or reentry, just being, you know, people of color. And for them to come into that facility and get those supplies, so harm reduction supplies, to save Black people who use drugs. Do you understand? It gave me a chill in my spine. I said, I know God is real. I know He is. You know, so this is the type of stuff people don't understand. When you get out your own way and out of your own stigmas and your things, what you know, and you start leading with this type of work and having morals and more about, you know, when you let that move you and you get out your own way, the work can start really be done. It really can be done. And I saw that when he called and told me that McDaniel. I know I told you a story, but I just had to share that because we building bridges, y'all, that have been, you know, decimated. You know, so I just want to share that.
And to add on to that, they also take our cars. So one of the things we do, like we help them get their ID, birth certificate, and Social Security. And a police officer mentioned, you don't understand how many people we stop that don't have a basic ID. And we always tell the brothers, you know, we trying to get you back in the game because you over here to stop you, you have to detain you up to 72 hours. So for the
Tonight's a technical difficulty night, but I think Mr. McDaniel was speaking to the fact that without an ID, if you're a returning citizen, you can be put back in the system just for not having your ID. And that was one of the things that Reverend Green really was adamant about, that was not going to continue to happen under her watch. Are you back, Mr. McDaniels?
Yes.
Go ahead.
So for the police officers to come and get our cars, and it's actually, they've been sending people our way to get their ID and just to see that their energy, you know what I mean, to come get the Narcan from us, to take me down and say, this is the area. And for the participants to recognize the police officer as well, you know, they gave me that sense of, you know, we can breathe, we can set up shop over here, we can come over here and make it a difference, because you got a police officers that come into your office, let's go over here, let's do this, come hit this area. But them that have that determination and that drive, you have to meet their you have to meet their energy. So I was just very excited. At first, my boss was like, the police was there looking for you. I'm like, I didn't do nothing. But it was like, they come to get the Narcan, they come get the ID cards, and they want to come out on sites as well. So I'm so proud of that. And also, we'll be doing an event with the Chicago police officer as well on the 11th of June. So we're really excited for that as well.
Yes, the city trains the police officer how to shoot and kill or maim or tase, and TRS teaches them how to save lives. Isn't that a miracle? Isn't that a miracle?
Isn't that a miracle?
We're giving the tools to save lives. And that's what this is all about, is we need to keep our community members alive so that we can do something with them tomorrow. Because we're losing too many people, not just to HIV and syphilis and other STIs or hepatitis C. We're losing people to overdoses. And we can definitely stop the overdose issue by walking around with Narcan or naloxone, learning how to use it first, and then carrying it. And when you see that person who's falling out in the street, that you can actually take action. So if you are interested in making a difference, if you're interested in keeping people alive, please reach out to TRS, schedule a training for your staff, for yourself, so that you too can be part of the solution. Because we truly want to be solution focused as we look to how do we end the HIV epidemic. And I want to turn it back over to our TRS speakers to kind of throw in some last words of wisdom. We have about 10 minutes left, and I know there are about 4 or 5 of you. So please take the floor, and I'm going to try to sit here and shut up.
I'll say my little bit and get out, because I tend to be a little long-winded. I've been told. I don't believe it, but I tend to be a little long-winded. I don't believe it. But anyway, I need people to understand that when we talk about harm reduction and we talk about needle exchange and we talk about giving out condoms and we talk about giving out smoking and snorting kits, we're not giving this out so that they can enjoy themselves. We're giving it back so that they can have an opportunity to decide they want to get off of that drug. You can't get off of that drug if you've overdosed. We're giving them that opportunity to live one more day so that they can come back and say, hey, I'm tired of this. We go to a rehabilitation center once a month to test and encourage. And the first thing I tell them is I congratulate them for making the change, deciding to change their lives and move forward. That day becomes the first day of the rest of their lives. And when you begin to understand that basis of understanding, the stigma of giving somebody a clean needle no longer means anything because you're giving them opportunity to live yet another day. That's all I want to say.
That's it. Short movie. Let's close it out.
This Carter, I'm gonna jump in. Can y'all hear me?
Yes.
Okay.
Go ahead, Ms. Carter.
Yeah, I just kind of, not to like change the subject, but I do want to go back to something that we were speaking on earlier, and that is like the lack of information to our returning citizens. I was a peer educator, you know, for like 6 years. I was a peer educator, so I got to see a great turnaround of people. I literally seen people coming in there 2 or 3 times. But what I'm getting at is, we were so backdated on the information that we could give them, even as peer educators. We were the most educated in the prison. You know, we were seeking the knowledge on STDs and the stuff like that to try to provide the information to those guys. And they wouldn't allow us to get a lot of information. I mean, our information was from the 90s and the early 2000s. So when U equals U came in and the PEP and PrEP drugs came in, we kind of knew, and we were it was put into our little jargon when we gave our spiel when inmates came in. But a lot of guys didn't ingest the information. It was just something that they heard and just went on. But I do think that is something that us outside need to do for our citizens inside, and that is to try, which by the way, Brother Muhammad is really doing, providing them with up-to-date information, you know, useful information. Yeah, I'm the most newest returning person.
And then
I just got out, and
another part of hunger.
And just me transitioning within the last couple of years, I kind of say it was a challenge because I was so back on things that I could have known, a lot of things I could have. So yeah, I just wanted to throw that back in there, and also with the stigma and the police. You know, since I began as a volunteer in 2020. I've made it my best effort to reach out to whatever police officer I've seen, wherever we were, and give them a card or something with our information on it, because I know how many individuals they cross that need one of those 3 things. So this is great that relationship is starting to blossom and they're starting to respond and actually correspond. I'm just thankful for all that. That's all.
Excellent. And Miss James, I'd like to hear from you, and then we're going to Mr. Jackson close out for TRS, and I'll close out for the meeting.
I think Kim has her hand up.
Can I just say one, because I have to get going. I just want to say that one thing that we need to understand is that all the work that TRS does is harm reduction. Everything from the screenings, the HIV Hep C screenings, to the medical case management that we do, to the harm reduction that we do, both in and out of prison. All of those things, pen pal programs that we do, everything that we do at TRS is harm reduction. You understand? We are empowering and encouraging other people to, take control of their lives and make better health decisions. And that's harm reduction. Okay. So I just want to end with that, y'all. I got to get going, but it's been great. Y'all, God bless y'all.
Okay, Ms. Jane.
Thanks, Miss.
I just want to say, I'm loving everything that we do at Transforming Reentry Service, due to the fact that I came to them in 2012 from Florida, not knowing nobody in Chicago, and they became my family. And we bicker, we fight, everything that a family does, but at the end of the day, we got each other back on the streets, in the office, wherever it is. It's like we big brothers and sisters to each other. All us been on behind those walls, and to do the work that we does, and our CEO and COO, and also our director to acknowledge us when we are doing what we supposed to be doing out here plays a big role in us continuing to do it, because we got people who support us and they thank us for where we at. You know, it's never a day that they don't acknowledge what we do out here, because we are a team, and we are a team that's to be reckoned with. The trainings that we do is amazing, because it's teaching us how to administer Narcan, how to administer naloxone, the proper way to acknowledge how to teach someone how to use our harm reduction kits. I mean, we sit on a day-to-day basis and put these kits together ourselves, so our harm reduction team have kits to go out with. We doing like 2, maybe 300, maybe 1,000, who knows, a week, putting out harm reduction materials. When people call us, we send them. We love to educate people on what we do out here as far as our harm reduction pieces and everything. I mean, it's just amazing how we have grown, and we still out here doing what we're supposed to do, even though, even in the event that we had that Saturday, I had an officer say, why is they out here giving out this stuff? Not knowing that I actually work for TRS. Why they out here giving out this stuff? And I explained to him. And after that explanation, he had a better perspective of what we was doing with harm reduction, as far as, do you want to keep picking up bodies off the street from overdosing? Or do you want to teach these people or get them clean supplies to keep them safe out here? And after that little conversation, he was like, I kind of sort of understand. I say, well, any day you could go to 601 South California, and trust me, they'll sit you down and teach you right. And it's the teachings that we give to anybody who asks for them. Just call us up. We got a South Side office and a West Side office. Trust and believe, we will make dates just to come out and train somebody on harm reduction. And that's what we do.
Call them up, folks. Call them up. And Mr. Jackson, why don't you bring us home?
Okay, so I just want to say that we've been doing this for a while. And you know, when you do something, I'm also reminded that, you know, that when you do something that you're really passionate about it, and I had to put this to a test, and you'll do it for free. I really had to do that for a while. You know, but it was okay. So when you're really passionate about something, you know, you will actually do it for free. The work that we do, can I share my screen one time, and then I won't have to talk as much? Andrew? Thank you so much. And I'm just gonna put this up here because this is my pet peeve. I'm gonna just put this up here. Can you see my screen?
Yes.
Okay.
Yes, sir.
So for the returning citizens, again, for people who are HIV impacted or infected or whichever, if you're not at the table when things are getting planned for you, then you're probably on the menu. And whoever does that, whoever plans something for me as a returning citizen, they do me a great disservice because I'm not at the table. I keep happening on being at the table when events are being planned. If I'm at the table, then we can have some input. If we're not at the table, and Kim and Reverend Green has given me a little latitude, where if someone wants us to come support an event and we wasn't in the planning, our logo ain't on the flyer, it doesn't make sense to me. So I just feel that we need to be at the table. We have a lot to offer. Like the picture I showed you, 94 years of incarceration. 94 years of incarceration. I mean, come on. That's a lot of experience. That's a lot of passion that goes by. And just to close out, I want to say, a lot of people come home from prison and jail and are successful, But they don't want nobody to know that they are returning citizen or they have a background. They just go hide and live their life hunky-dory, as opposed to coming back and giving back. So that's the difference between us and them. We want to give back. We want to let people know who we are, be out there. Because if a person, the greatest thing I could do for a person to walk into office is to make them feel comfortable, letting them, hey, I was there too, but don't worry, don't feel bad. When you came home, just when I came home, what joint you was in, it just relaxes a person. It takes away all the stigma or whatever goes with it, and you can be able to help that person. He'll be able to open up to you and tell you what's going on with him, and then you know whether you'll be able to help in the system or not. Thank you, Al. Appreciate it.
Thank you, Mr. Jackson. And we really want to make this statement a broader statement. We know that we need our reentry people at the table. If you're saying you're doing reentry work in your organization, who is at the table representing the reentry population? If you're doing work with MSM, who's at the table representing MSM? If you're working with a house ball community, who's at the table for that community? We are having conversations with all of those communities in the upcoming weeks. Please join us. We want to hear from them what they believe they need. And clearly, the reentry community, the CAB has spoken and said, we need you to see us as human beings first, not as reentry people, but as human beings, and to treat us accordingly, to give us options, give us education, give us resources. So as you do the work you're doing, we want to really lean into those messages. Let us lead with love, not judgment. And I think that if we do that, we will reach not only the reentry population, the reentry community, but many others who have been missed by our agencies in the past, because we're so focused sometimes on the money and on developing programming that we're not implementing it in a way that the community is accepting it. So let's keep doing what we're doing, but do it wiser and smarter, and include the communities at those tables. Make sure that they are represented at the table and not just on the menu. I'm going to turn to Pastor Straight to close us out, and we welcome you to come back and join us next week, same time, same channel, as we continue our conversations of engaging community. Reverend Straight.
Mr. Jackson and all of our speakers tonight for having such a great presentation and helping us to understand better the needs of our reentry family. And I am very intentional about using that word, because these are our sisters and brothers. These are our sons and daughters who are coming back into the community from having been incarcerated. And we really have to be able, at some other point, I know that we are out of time tonight, but we've got to talk about the issue that was brought up by Kim of over-policing, because they won't be returning if they haven't been taken away in the first place. So for us to address the issue of over-policing in our communities and ways that we can stand up for our young people in particular when they are harassed and arrested and then put into a system that causes them to have the kind of problems that they have, that we then must turn around and address. Thank you so much for everything tonight. And I am really looking forward to more conversations with you guys in the near future. Al, me to do anything else?
No, peace and blessings, happy Pride, and thank you for joining us. And join us again next week.
Thank you all for attending. We'll see you all next week at the same time, same place. And thank you again to our speakers. Have a great evening.